Based on the evidence that we already had in a curative cancer setting, we see still that it's really hard to implement exercise as part of cancer care. So I think this won't be different in the metastatic breast cancer setting. But as part of this study, we also interviewed a couple of stakeholders like healthcare professionals and also healthcare insurers and policymakers to see what kind of barriers might be there that hamper the implementation of exercise. And what we saw is that a major barrier is, of course, the reimbursement. So far, exercise is not being reimbursed for cancer patients, which is, of course, a major barrier for it being implemented. And other major barriers are, for example, that there is still a lack of knowledge on the positive effects that exercise has in the cancer setting. So it's really up to us, but also to, I think, other stakeholders to inform healthcare professionals, but also the patient about the positive effects of cancer and really increase the awareness around this. And then, of course, we also need to it's of course a lot of workload for healthcare professionals to discuss this in the room with the patient. So I think we also need to see how we can easily integrate this in a consultation with a patient. So I think there are a lot of things that need to be improved before we can really implement it solidly.